Okay, let's start.
Okay, sir. I start. Hello everyone. I seize this opportunity to extend a warm welcome to each and every one of you to our Learning Through Sharing series. This is an initiative of Dr. Kalatia, sir, and we all are very grateful to him for having created this kind of a platform for us to share and learn from each other. In the earlier the sessions in the series, you must have seen all my fellow colleagues who have shared their invaluable knowledge through different topics and different cases. And I'm really very grateful to them to having shared their knowledge with us. Yeah, so today is the ninth session, and this marks the last session of the series. Let me introduce myself to you. I am Dr. Naaz Kazi from Mumbai, and I am into practice for the past 26 years. And it's a joy for me to have joined you all here to be sharing some insights and knowledge. So let's make the most of this session together. So today, as you all know, I will be sharing some insights about mollusk, which is a diverse group of sea creatures. Yeah, and I have tried to include in my presentations as much as knowledge about mollusks that I could, like their introduction, yeah, then them being the type of animals, they are invertebrates. So we will understand some qualities about the invertebrates. Them being sea creatures, we will try and understand the qualities of sea creatures that we will see in our patients. Then they live in the sea, that is aqua marina. So we will try to understand some features of aqua marina as they express in our patients. Then we will see the generalized anatomy of all the mollusks, and we will see how this anatomy structures, how they represent our patient's experience, these structures, and they express in our patients. Then we will see the classes, how they are classified, right? We will see the structural differences in the classes. We will see the different remedies that we have in homeopathy from these different classes, the miasms of the different classes, and then we will see a case. After seeing the case, we'll do analysis and we will study the remedy, right? So am I audible and okay?
Okay,
Yes, sir?
go ahead.
Oh, okay, sir. So let us see the phylum Mollusca. In Latin, the term for mollusk is mollusca, and mollis means soft. This mollusca is the second largest phylum of invertebrate animals, the largest being the arthropoda. We know the arthropoda, which include the insects, right? We know the ants, the bees, yeah. Then the crustaceans, which are the crabs, the lobsters, right? Then we know these arachnids, that is the spiders and the scorpions. And also there are a small group of invertebrates which are known as the myriapods, which are basically the centipedes and the millipedes, right? So this word mollusca is used to refer to this broad group of soft-bodied sea creatures, which have a hard shell or they have no shell at all. Let's go further. And as we've seen that they are the invertebrates, so let us understand the qualities of the invertebrate. The broad classification of animal kingdom is done into two, that is the vertebrate animals and the invertebrate animals. The difference being that structurally the invertebrate animals do not have a vertebral column. We all very well know that. And because they do not have a vertebral column, their nervous system is open and it is undeveloped, due to which all the sensory inputs from the external world like come in a form of exaggerated way. So they have many pains. We all know pains like the shooting pains, the kind of stinging pains, many pains they have. They're very sensitive to noise as well. They're very acutely sensitive to noise. We know some of the spiders, like we know Theridion, which is very acutely sensitive to noise. They startle with noise. They're very sensitive to touch as well. to light, and to vibration. With this, that having these pains, they are even prone to have tics and jerks. And to some extent, these patients who require the the invertebrates, they are very sensitive, and they appear like plants. But here, we need to differentiate because the
Just
plants,
okay.
yes, sir, okay. So the plants will basically, yes. Am I audible?
Yeah, go ahead.
Yes. So I was saying that all the sensory inputs which they experience in an exaggerated form. So they have many pains. We know the pains of cantharis, of apis, the burning, stinging, poking kind of pains. They are very sensitive to noise, acutely sensitive. As I gave you an example of pteridion, they are very acutely sensitive to noise. They will startle with the least noise as well. They are even sensitive to touch, light, and vibrations. Having so much of sensitivity, sometimes these cases, or most of the time, these patients they appear like plant kingdom, right? But in the plant kingdom, the difference will be that the plants have one sensation and the opposite. But these being animals, they are very complex and they have many sensations, multiple sensations. Now, one more differentiating factor between the vertebrate and the invertebrate is having a specific aggressor. The vertebrates basically have one specific aggressor. We get patients who say, my boss is the problem, my mother in law is the problem, somebody will be there doing something to them. But in cases of invertebrates, they do not have a specific aggressor. Everything out there is a danger for them, everything affects them. Then they have the sudden theme of sudden death because we know that they have a lot short lifespan. Yeah. So because of that, they have this very strong fear of sudden death. Now, in the way that these sensory inputs are experienced in an exaggerated manner, even the reaction has to be the same way. Yeah. So the reaction is in a hyper form. They hyper react to everything. They have a lot of panics, extreme mood changes. The defense will be to withdraw, to retract, to hide. They would always need a kind of a shell or a shield like protection. Or there can also be speed. Now, how are these personalities that come to us? They will be very primitive. Why primitive? Because they are very early in evolution and they function by their instincts. That means they need immediate gratification for for their desires, right? They are very materialistic. They need a lot of material um resources or sources, yeah, and they are very self-centered in a way that everything is around them. It's like I, me, my, everything for them. So these are the qualities of the invertebrates. Now, our mollusks are also sea creatures, right? So let us understand the sea creatures. What are sea creatures and how will they kind of express in our patients? Um, how would they express in our patients? So how is it like? Because as it is, we said that they are very primitive, right? Primitive means early in evolution. As we know that life began in the sea, right? First came the sea animals. Then they went on to the land and they became the land animals like the mammals. Further, they wanted their own space. So they evolved to fly in the air, right? That's how the evolution happened. So these creatures, basically the sea ones, they are very primitive, the first ones to develop. And they live in the water. And the water is like a big womb because we know that water is the main component of the womb, the amniotic fluid, right? So we know that. And hence, for these creatures, living in the womb, or living in the water or in that sea body, is like living in the womb. And hence, they appear like the second row of the periodic table, that is, the lithium line. And all their fears will be like the lithium line. Fears of the unknown, they will need a protection, a womb like structure, the shell. They have a lot of fears from the ghost and the hidden world. Now, since we said that they live in the sea, which is the aqua marina, which is common to all the sea bodies across the earth. And aqua marina is their environment which they live in. And since they live in this environment also has to have some kind of an impact on them. And our patients will also express these features of the aqua marina. So, as we know that aqua marina is basically of the same composition all over the earth, all the water bodies, and it is made up of many minerals like the sodium, chlorine, silica, bromium, carbon, boron, fluorine. But predominantly it is made up of the sodium chloride, that is natrium mure. Approximately 85% of aqua marina is sodium chloride. Hence, our patients will show expressions of natrum. There will be a lot of natrum-like features. They will be closed, clamped, reserved, shy. They cannot speak up. They'll be naive and emotional. They will also have silica-like features of being image conscious. And the aqua marina has a very strong delusion. In the repertory, it is given as washed is being. What does this mean? That these um, um, patients who require this kind of sea creature remedy, they would be basically having this kind of a fear that there is something wrong in them and everyone around is looking at them. Hence, they need to hide and cover up because they feel themselves inadequate. As it is, they do not have much resources. They are early in development, in evolution. Hence, they feel very inadequate. And aqua marina is also having a very strong psychotic miasm. It is known as the king of psychotic. Okay. Now, let us see the anatomical structure. This is a generalized anatomical structure of the mollusk. I hope I'm not very fast. My pace is right. Is it, sir?
Yeah, perfect.
Yeah. Okay, sir. So grossly, whenever we look at this creature, the mollusk, it has basically two parts. We see a hard shell and a fleshy part, which is the body. But to understand this, let's see. So this part over here, this is the shell part, and this is the visceral mass. Okay, the body is again divided into two parts: the visceral mass and the foot. This foot, it functions different in the different mollusk. For example, in the snails, they use it for crawling. In the clam, they use it for burrowing and digging, right? And this visceral mass, it contains nothing but all the internal organs, the heart, the reproductive organs, the digestive organs, and in between the shell and the body, the visceral mass, there is a thin tissue like structure which covers the visceral mass like a kind of a membrane like, and that is known as the mantle. This mantle is responsible for the kind of maintaining the water balance, right? And also in between the mantle and the body, there is something known as the mantle cavity. This cavity has a lot of fluid in it. It's a fluid structure cavity, and this is responsible for the excretion of the waste from the body of the mollusk and to take the oxygen or basically the oxygen from the water. And it has gills present in it, which work as respiratory organ for the mollusk. There is something known as the radula, which is like a tongue-like structure, which is the feeding organ for the mollusk. And this has some toothed appearance, and they use it for scraping and cutting the food or the shell, whatever, right? And in some mollusks, they have this kind of complex nervous system. Hence, there is a head, a well-formed head with sensory eyes and tentacles. Also, in this image, there is there's one structure which is known as a siphon. What happens is this mantle, when it joins at the end, at the edges, it forms a tubular structure like. So, in one type of a mollusk, it looks like a telescope on top of their body, and they keep hiding in the base of the sand. And this structure, which is known as a siphon, is kept out like a telescope, and it is used for basically for the water inflow of water and the outflow of water into the body of this animal. So this is what I spoke of. The shell is made of the calcium carbonate. The body has this mantle, the visceral mass, the foot, the radula, which is the tongue, the siphons, which are the tubes that which through which the water enters and leaves the body. There are gills for respiration. The mantle cavity we've seen, which is a fluid-filled cavity between the mantle and the body. Yeah, and the head, right? So now understand why is it very important to understand this? Because when we go in a case, like when we are deep in the case, we reach the level of source in a case. The patient can speak the experience of this these parts, and we will have words of that, which we'll see a little later, and then we can know which one, which of the mollusks we should prescribe to the patient. So now we come to the classes of mollusk. Basically, they say that, I mean, I have read in Sir's book, Dr. Rajan Sankaran's book on mollusks, where he writes that there are 10 classes of mollusks, out of which they say that 2 have been fossiled and 8 are living. But out of the 8, we know these 3 main. So, first is the bivalvia. Uh, if we just bifurcate this word, it is bi and valvia. Bi means 2 and valvia means the walls, and there are 4 of them, that is the clams, oyster, mussels, and scallops. Then comes the gastropoda. Gastro meaning the stomach, poda is foot. So this class, they especially, they mostly walk on their stomach, that is on the tummy. And we have snails and limpets here. We also have murex here. Then we have the cephalopoda. Cephalo is head, right? So they have a well developed head. This is cephalopoda. This was the bivalvia, this was the gastropoda, and this is the cephalopoda. We have here cuttlefish, which we very well know are sepia, nautilus, and octopus and squid. Now let us see how the classification happens in them. So basically, the classification is based on the difference in the shell and the foot. So bivalvia, as we know, that it is double shelled, enclosing the soft body. So it is a double shell structure, and there is a soft body inside. So the animal remains completely enclosed inside. In the gastropoda, they have a single wall and it is coiled. And the animal is very, like it's partially covering it. It's having the shell on its back and it's partially enclosed into the shell. The cephalopoda, in that the shell could be internal, as in case of sepia, it could be external, as in case of nautilus, or it could be absent, octopus, in case of octopus. And basically, so the shell does not have any function for the cephalopods. It's a non-functional shell for them. In case of bivalvia, the head is reduced. In case of gastropoda, the head is well developed with eyes and also with tentacles, right? And in the cephalopoda, they have a well developed head with eyes. Foot, in the case of bivalvia, may or may not be present. But in the gastropoda, they have a large flat foot, which is used for digging and for moving, for locomotion. In the cephalopoda, this foot is divided into tentacles. Now, the movement, that is the locomotion, in the bivalvia, it is very poor. They do not move, very little movement. There is one class of, one species of bivalvia which just remains stuck, fastened to the bottom structure. Yeah, and its survival basically depends on that. The gastropoda, they move by a creeping, crawling locomotion. The cephalopoda, they are the fastest ones. They just rapidly, just like they say, it is jet propulsion kind of a locomotion. Let's see more of it. So in bivalvia, as we already seen that they are 2 shells. In the gastropoda, we've seen that they move on the stomach. Cephalopoda has a developed head. Now, the feeding or the food habits of bivalvia is basically they are herbivores. They usually filter the algae and the plankton in the water. The gastropoda, They are herbivores as well as carnivores. They feed on the small, slow moving or attached animals. Cephalopoda, they are active carnivores. They prey on crabs and other mollusks. Now, the locomotion, the type of locomotion in bivalvia. So we seen the four types. So in that, the clams, how do they move? What would be their movement? It will be they dig or they burrow. The oysters, as I said, they fix to the rocks, right? The mussels, they attach to each other. And the scallop is the fastest moving in the bivalvia. It has two, I mean, the shells, it just claps and it claps its shells and it just swims away whenever there is any kind of a danger. And the gastropoda, as we know, they slide and they crawl with that large foot that they have. The cephalopoda, they have buoyancy. They kind of have air-filled sacs in them, and because of that, they become buoyant. And also, their movement is by jet propulsion, right? So we have seen all this. Now let us see the remedies that we have from them. In bivalvia, we have Crastoria gigas, that is the Pacific oyster. We have Concholinum, mother of pearl. We have pearl, which is from Mytilus edulis pearl, or we just have the animal Mytilus edulis, which is the common blue mussel. Venus morcinaria, which is the hard clam. We have Pecten jacobus, which is the scallop. In gastropoda, we have Helix tosta, which is the toasted edible snail. We have Helix aspersa, which we must have seen in the garden, which is known as the garden snail, right? Then Cypria eglantina. This is cowrie snail. Patella vulgata, that is limpet. Murex purpura, which is the purple fish. Cephalopoda, we have Nautilus, right? We have octopus, sepia, the cuttlefish. Loligo vulgaris, which is the common squid. Elidon cerosa, which is the small octopus. Then Onychoteuthis banksy, that is the squid. So these were the remedies from the three classes. Then we need to see also the methods of attack, because all these words, when we read these words, as I said, when we go deep into the case taking, patients speak of these words and we should be aware of them. So methods of attack are by gripping, grabbing, mostly in the cephalopods, boring, suck out. There are some, I mean, most of the snails, what they do is they bore into the clam shells and they suck out that animal and in a kind of a soup form, and they just consume that. They use poisons by shooting. This is a tactic which is used by the cephalopods. Then they disguise or mimic, mostly in the octopus, cuttlefish, and the squid. The cuttlefish and the octopus, mostly the octopus, they are great in disguising themselves, mimicking. They turn into some kind of a other animal in the sea there, or they might even look like a rock. So they use this even to attack and even as a defense mechanism. Now let's see the defense mechanisms. So the shell, as we know, it is hard and it gives protection in danger. So the animal basically withdraws into it by contracting its bodies. The threats to the shell can be broken, it can be smashed, it can be bored into, or it fastens to the substrate, or it flee with the speed. As I told you in the scallop, they just clap their shells and they just swim away, right? They camouflage by changing colors. There is a mechanism which is known as aposematism. Apo is away and semat is warning. So some of them, these mollusks, what they do is they secrete a harmful fluid, something like a distasteful, which is not palatable to the predators. It will put off the predators. So as soon as the predator comes, they kind of secrete this on their body, and the predator comes close to them and tries to just taste them, and it feels very awkward and very awful and just blows away. Sometimes they even startle the predator. That is, they show some different colors. All of a sudden, they might be looking different, and all of a sudden, they show some different colors, and that startles the predators. They escape, flee, hide, withdraw. Then this is spurting, squirting, releasing. This is mostly in the clams, sorry. The clams have siphons. So what they do is, whenever they want to hide, they just bury themselves into the sand, and they have the siphons, as I told you, some like a tube-like structure, where they just spurt out the water jet on the predator. Then cephalopods, mostly the cuttlefish, that they have this inking. We know the sepia inks. So what they do is they kind of throw some kind of ink into the water, and this kind of blurs the vision of the predator, and the predator cannot see, and sepia just runs away very quickly. Then some of them they detach their body parts. Mostly the octopus, it has this ability to kind of give away its arm. They have so many arms, right? So if the predator gets hold of one of the arm, it just leaves the arm and it just go away, and it can again regrow this arm back. They use some destructive chemicals like poisons. This is also, I mean, mostly the cephalopods use this, but for shooting with the poisons, and even some other of them. Then how are this all expressed in our patients? After having this knowledge, like how do they express in our clinics? So first of all, we will come to the animal kingdom, where we will have victim aggressor themes. We will have the hierarchy, survival, competition, right? And then we will see the subkingdom, the mollusca, the words of which are related to various aspects of the mollusk. That is what we seen in the previous slide. We seen all the structure of the mollusk, because somewhere we will find these words in our patients. So let's just have a look of what all this can be expressed by our patients. These are so many words, but this all becomes important when we are in that deep phase of case taking. So in the body and the mantle, the experience could be soft, it could be delicate, gelatinous, mushy, squishy, uh, wrapped around, fleshy, wobbly, spongy, sucked in. All these words can be there. This I have taken these notes from Dr. Shankaran's book on mollusk, so you all can read it there. The qualities of the shell, they will express it as an enclosure, as an armor, as a wall of fortress around me, a mask, a nook, a crevice, a wall of myself of covering, shield. Then experience in the shell, how would that be? They would say that self-centered, self-contained, in my own world, secluded, right? It is claustrophobic. Then they could give it as I lose contact, lose excitement, right? Then the physiological functions of the mollusk, in that they will say the swirl, whirl, swirl, inflow, outflow, especially for that siphon, they mostly give it inflow of fluid in or outflow, blocked, clogged, flush out, right? In the habitat, they might say the quicksand or the sea or sinking, right? Then the threats to the shell, we've already seen that: smash, crush, break, all this can be expressed by these patients: hammer, punch, break in, penetrate, stab, shatter, fall, right? The vulnerability, they would say they feel exposed, unprotected, they need protection, they need shelter, security, they want to go inside, close in, shut in, go out of reach, become inaccessible, keep the world out, right? Some more, the defensive action. So they could give us, I conceal myself, cover up, pull myself in, go into my shell, pull in and closed, bunching, contract, burrow, dig, coming together, bury, conceal, so many of them. Then stages of the muscle mollusk life cycle, they would say: float, drift, swim, not grounded, anchor, fasten, secure, sink, down. The miasms, basically all these bivalves, they are mostly the psychotics, all of them. The Cypria eglantina, it is malaria. Helix tosta is tubercular. Sepia is leprous, and Octopus vulgaris is again leprous. Now that we have built on upon this knowledge, uh, can we take a case? Yes, sir.
Yes. But before going to case, if anyone
Yes.
have any question or not understand anything, then you can
Yeah.
ask it.
Yes. Has anyone any questions? Anybody wanting to ask me something before we go into the case? Okay.
Okay, go ahead.
Okay, fine. So I start this case. This is a very old case, approximately 10 years ago. I had taken this case in December of 2014, and this was a lady of 32-year-old. She came with psoriasis of the skin and the joints. So she had, and this case I had done it on Skype because she stayed overseas. And at the time when she seen me, she was in a very bad shape. The skin was also very bad, uh, and the joint, especially because she had this on her sacroiliac joint. So it was she could not stand because of that, and she had a job where she had to stand most of the time. She had to leave the job just for this disease, and she was put on methotrexate. She was on heavy painkillers when she came to me. So let's see the case. So I ask her, what are the complaints? And she says, I have psoriasis on my palms, on my back, neck, fingers, and the sacroiliac joints. So I ask her, what happens? And she says, skin of the palms is dry and itchy. It cracks and cuts. There are cuts on the palms. So I said, okay, what happens to them? And she said, it's like it burns like as if it's on fire and it kills me. So I said, okay. So I said, what else? What other complaints do you have? And she says, I have this migraine. And I said, when are the, I mean, how is the head pain? So she describes the head pain. She says it is more in the sun. If I'm traveling, it's more. If I exert a lot, then I have this head pain. And then she says, the head pains, they kind of take over me. So I ask her, okay, what else? What other complaints do you have? So she has some fibromyalgia, some low blood pressure, the cyst in the left ovary, genital herpes. Then there is, she says, I have, doctor, because of all this, I have massive depression. Sometimes if I'm empty stomach, I feel nauseated, and I have the soreness in the vagina during coition, and I have a low sexual urge. So, with she giving me so many complaints here, with the physical complaints we seen, and even these more complaints, so I put this question to her of what, what is the effect of it, how it affects you. And she says, Doctor, I'm just fed up of having so many illnesses and medication. It bogs me down. So, in this uh, at this point in the case, is it something that we can note, or uh, is there something that we could put in the repertory, or what about the chief complaint? Have you all any thoughts? If some of you all have some thoughts in just these three, four slides, can you please unmute and say something so I can understand that you are with me in the case?
Yes, you can share like
Yeah.
what you see peculiar till now.
Yes, yes. Is there something that is characteristic till now? Is there something that really, you heard of something different in the case? Or even we could talk of the levels that we crossed in the case. No thoughts?
She said it kills me and it takes over me,
Yes,
which
very
may
nice.
indicate the animal kingdom.
Yes, sure. Sure. But just because we know that now we are doing a mollusk and it's an animal, it becomes much easier, right? But when I had taken this case, so it is like, of course, you're right. We can just make a small note of it, right? Otherwise, we wouldn't think of it, right? We could just make a small note of it. But you're right, definitely, right? So, anybody more want to say anything? Yeah. All right. So I just go ahead. And so as we seen, we crossed the level 1, which was the name of the disease, that is psoriasis. We seen some facts where we just had the burning pain, it is itching, it is dry, it burns like fire, right? And but we can't put these things into our repertory, right? Because these are not very characteristics. And also that all the skin cases, and especially of psoriasis, they just come with this kind of a complaint, right? They just give you this one complaint, and that is it. That I just have this itching and I just have this dryness. So, as rightly said, of course, even I make a note of it that she says the way she describes the chief complaint. She says the burning, the itching, it kind of it kills me. Then the head pains they take over me, and everything, all of the complaints they bog me down. So I make a note of it. Also, I make a note that it is not a vertebrate kind of a language because there is no one doing this to her. It is she kind of personifies this illness, where this illness is somebody doing something. So this is just a subtle kind of a hint, but I do not make any concrete. We can't make anything concrete at this moment, right? Because when I took this case, I didn't know it was an animal. Then we go further and I ask her some physical generals because there is something that when the patient is not giving, we have to keep on searching and seeing the different areas. So here she says, I cannot tolerate heat. I have a lot of perspiration, which is more on the head and the face. Then she says that in the food cravings, she likes eggs. There is aversion to meat. Yeah. So I can repertorize this, right? So I somehow put it in the repertory. Then I go into the life history, life story of the patient. And she says, Doctor, I come from a very big and happy family. Financially, everything, we are all well off. And she says, I was the youngest and very close to all of my family members. Everything suddenly changed. Yeah. What had happened is her mother, her sister, her father, they passed away one after the other in a short period of time. This was a very kind of, for anyone, this is a great loss, right? Losing a family, that too, one after the other, at least three members in a family, and having a family which is happy kind of a family and losing them one after the other. This is a grief state. So I just asked her, how was it for you? Because I needed to know what is the loss for her like. And she says, I had no one to go to. I lost all of them. There is no security, financial or emotional. No one to support you. Whom to go back to? She means to say that if I'm going to the office and coming back, there is no one to go back to. Tomorrow, if you lose the job, there is nothing for you. It's hopeless, insecure, alone, no savings, no financial security. And she weeps a lot. Yeah. And after having that pause of weeping, she just starts and she says, I'm very close to my elder sister. She had one elder sister. Out of all those members whom she lost, she had one elder sister. And she says, she's like a rock. She is a rock. Yeah. She's my strength. So I needed to understand what is the strength for her. Right. So I ask her, what is the strength? And she says, she gives me grounding. She gives me security. She gives me support. So I ask her, when she's giving me this, I ask her, what is the opposite of this? And she says, it's like a free fall. It's like falling from the sky, diving in deep waters. At this point in the case, is there something that we have noted? Is there something that is very different kind of a language? Or it comes to some kind of a kingdom? Can anyone please see that? Anyone? Have you all noted something?
Mineral kingdom.
Okay, what were the words?
It's security,
Yes,
financial,
yes,
emotional.
yes, exactly. You're thinking very right. Even I was thinking the same kind of thing in my mind. I had those subtle hints of the animal kingdom, which we made out, right? Then when
Yes.
we came here, we thought of the fourth row, right? Mostly having a financial security, no one to go down, no one to go back to, right? So at this juncture, definitely, even I was thinking of some calcaria, right? But here, if we understand that we have just crossed the emotional level, we are into the delusion. So we can't really make out of having some words of the animal there, some words of the mineral here, but I stay with this and I go further, right? So we go into a different area and we go into the subconscious, right? We ask her the dreams. And when I ask her the dreams, so she says, Doctor, I get lot many nightmares. They are horrific dreams. So I said, what happens in your dreams? And she says, it's like someone comes to kill me or get me or tear me. Okay. So I said, okay, what are the fears that you have from childhood? And she says, I have fear of snakes. I said, what is the fear of the snakes? And she said, they can be slimy. They can attack you. And one more fear she had was of the death. I said, what is the fear of death for you? And she says, you are alone in death. I said, oh, how does that feel to be alone? Yeah, you are dead. So how does it matter? So she said, yes, doctor. It feels as if the air is sucked out of your heart, as if you're choking. So here again, I will ask y'all, is there something that matches to whatever we went through earlier in the case? Can someone say?
Here it is very clear. This is animal
Yeah,
kingdom
right.
because
Yeah.
someone tried to kill
Yes,
her.
yes, yes. Because
So
this
animal kingdom is decided. Next we
yeah,
have to go super class.
yes, very right, perfectly right. So we have the in the earlier the chief complaint where she says it kills me, it takes over me, it bogs me down, right? So we come to again, kill me, get me, tear me in the sub conscious level, and also in the fears we see the same thing. Somebody can attack, so we are sure that yes, this is the animal kingdom. Now we need to go to the sub kingdom, right? Very easy. So now going to the sub kingdom, what do we need to know? So here again, I ask her, tell me about you. And she says, I get scared of people most of the times because they can take advantage of you, they can hurt you. So I said, what advantage like? She says, I was very sweet, I was gullible and nice to all. I was misused, taken advantage of. I was hurt by many people. So now we are very sure. Earlier, also in the earlier slide, we seen what she said, and here also we are sure. This is some animal, but now, as you say, we have to see the sub kingdom and we need to see the defense mechanism. So here, when people take advantage of her, they hurt her, how does she react? That will give us the defense, right? And then we can know the sub kingdom. So I asked her, how you react? And she said, I would just go back, close up, and cry, not speak up for myself, right? So are we sure now of the sub kingdom yet, or we still need to wait? We
Is
still need,
to
yeah,
go out, come back.
yes. So we did get this kind of a reaction from her, but still we need to be sure on it. And she says, I be different with different people. So I wish to be alone at times and at times in company. So I just did not understand this, right? So I said, what do you mean by being different with different people? So she just came out with this kind of a word where she says, it's like I have a covering. And at that point, 10 years ago, this was very different for me because I had not even read the book of mollusk, right? So it was like, it's like I have a covering. And then I know that now the language will be something which is not comprehensible by me, neither by her. It will be something which she might be feeling, she might be kind of seeing visually in her vision, in her subconscious vision, or anything of that. She could make some noise. So I had to be very careful and take everything. So I just put the words which she gives to me, I put it back to her so that even she understands and she tries to see what it is. And she says, when I ask her about the covering, she says it's a plastic shield and I am in control. I ask her, what do you mean by that? And she says, I can let in and out whatever I want. So I said, let in and out. And she says, I can filter. I can let self be affected by what they say or not accordingly. I can't put my guard down with people. It's like self preservation. Need to protect myself. So I ask her, protect? So she says, from bad experiences, from bad people. Never will anyone walk over me or take advantage. It's so beautiful, no? When we go to this level. And then again, for me, just to make sure everything, I keep on asking the same thing again. I ask her, what is in and out? And she says, take in good energies, flush out negativity, and bad energies. So something she had said earlier in the earlier slide, she had said it's like a filter, right? So I ask her, what is the filter? And she says, it's like being in charge, control of my life. I can filter whatever I want to affect me or not. It's like if I want something to be affected, to affect me, I will let it. But if I don't want it, I will filter it out. That's what she meant to say. Then I ask her the qualities of the shield, like how is the shield, the experience of the shield? And she says, it will not shatter like glass on my face. She's so very clear with it. It will not shatter like glass. I can see outside. They cannot see inside. It's like a shield around. It's a temporary one. Only around when I want it. I can maneuver. So for me, at that moment in time, it was very difficult. But today, when I read this case again and again, I see how beautiful it is. So she says again the shield quality of the shield. She says it's not heavy, it's strong. It's like it will not break easily. I feel safe. So I ask her, so without the shield, how is it for you? She says I'm vulnerable, left to be attacked by the bad energies. I ask her more qualities of the shell, and she says outside the shell is tough, inside is this soft, and anyone can eat it. It is softy inside and easy to hurt. So beautiful, right? We spoke of the structure being too structured grossly when we see a shell and a soft, and she's really describing that to us. She says, in a bubble, I can see out, but people can see me only if I want to be. If I want them to see me, right? And I ask again, what is vulnerable? And she says, it's easy to stamp, crush it with feet, scramble it, tear it apart. So we get all the words of this creature, right? So before going to the analysis, I'll give you the follow-up. I have I have the follow-up on even the pictures of the follow-up, but this being a bigger group and we being on YouTube as well, it is not appropriate for me to share that. And but you should believe me, I had lovely pictures in the very next month, you can say, because December I gave it to her, and January, and this is just February 5th. Even so much so that after 1.5 years when she came to India, she stays overseas, right? So she came to India and she did the MRI of her sacroiliac joint, which was normal on that MRI scan, which earlier had ilitis, the sacroiliitis, and later on it was not there. So that was a very nice kind of a follow-up. So in the follow-up, she says, I'm much better. I have a lot of energy now. The psoriasis is better. It is reducing. I am feeling energetic. I can walk much more now. Can do my work for long hours. Earlier, we knew that she couldn't stand with the pain, right? Mentally, she feels better. The migraine, even the head pains, she doesn't have them. She has some back pain, which is worse on stooping and worse rising up from stooping. Then I seen her the next month, that is in March 2015, and she had some colitis, some urinary infection. But since she stays abroad, she took allopathy and got settled with that. Now the back pain is much better, she says. The migraines have improved. The skin has also improved. Then this follow-up happened after a few months. That is, this was March and this was in August. So here she comes up with again the finger and the toenails. They have the psoriatic patches again. They have come in the last 1 month or so. So now we need to understand exactly what must have gone wrong, because this is an autoimmune condition and any emotional turmoil can bring on the flare up, right? So I just wanted to understand what happened. And she says, I had a partial breakup with my boyfriend and now we live separately. So I said, how is that for you? She's saying, my world has crashed. I will be all alone, insecure. It has pulled me down. She makes this kind of a hand gesture where she shows, clawing and pulling it down. I don't want to go out, just be home and talk to no one. So I said, what do you feel? And she says, Doctor, I feel the bubble that I was in is shattered. And she really weeps very badly. This was kind of an emotional, emotional turmoil kind of a movement for her, right? And it is gone to pieces, and I'm like gathering them and I'm trying to fix them so that I get it back again. My bubble, my shield. So I ask her, how do you feel in this bubble? And she says, it's cool, it's safe, it's comfortable, it's spacious. I can see everything outside. It protects me from the world. Only if I want to, I can allow the world to see me. The same kind of a sensation or the same kind of an experience comes up again, right? So for me, that I know that yes, I am on the right track, and it is the same thing. I just need to do something with the prescriptions, right? I ask her the bubble again, the feel of the bubble. She says it's soft from inside, almost like a soap or a jelly bubble. From outside, it is hard and nothing can penetrate, right? Then again, I had a follow up after that, and this was in March 2016. And she says, I am much better with all the physical complaints now, but I am getting too angry nowadays because earlier we know that she wouldn't express. She would just close up, right? That was her reaction. But now she's getting angry and I shout and then express it. So that's a good thing for us, right? I apologize then because, of course, she might be feeling bad that she was not used to do that. Either I want people around me, else I will close into my shell. That is what. She also gave me an audio follow up, which I have where she speaks the same kind of a thing, right? So now we come to the analysis. Any suggestions for the remedy? What I must have given?
It seems to be calcarea carb, ma'am.
Calcarea carb? Yeah. Yes, you're right.
Yeah.
Yes,
Speaking
yes,
about
yes,
shell protection.
yes, exactly. You're right. You're right. You're very right. You know, uh, actually, I would have given her calcarea carb, right? But somehow I did not give her calcarea carb. And also the teachings from Dr. Mahesh Gandhi sir, he always tells us, I was doing this FHPC, that is Fellowship in Homeopathic Psychiatry, and under his mentorship. So sir teaches us that whenever you come to a case needing calcarea or calcarea salts, always keep your eyes open to a mollusk. But this was not 10 years ago, right? This is just a recent development for me. So you're right. I could have given her calcarea cup, but I have not given. So anybody else with any other guesses?
It's
Since
a snail with hard covering.
okay, fine. All right. Anything close by?
Clam.
Okay, that's right. Anything else?
Clam.
Okay.
Yeah.
All right. How many
Yeah,
clams?
yeah.
How many clams? Many of all giving clams? Okay. Let me see. Should I go further? Yeah. So of course we have the animal kingdom words, right? We have the dream, someone comes to kill me, get me, tear me. Also the way she describes her chief complaint, it kills me, the migraines take over me, it bogs me down, they take advantage, they hurt me, I can't put my guard with people, it's like self-preservation, need to protect myself, all the words in the case, right? Then we come to the mollusca, right? So it is inside is soft and anyone can eat. Softy inside, I can maneuver, I can see all around, I can let in and out whatever I want. Vulnerable, left to be attacked by bad energies. I would just go back, toes up and cry. Rock, grounding, security, all these words. So the class that I gave her was the bivalvia. Okay, so these are just the words of the mollusk, again vulnerable to be attacked. So in the bivalvia, we have the outside shell is tough, inside is soft, and anyone can eat. Softy inside, easy to hurt. I can let in and out whatever I want, right? I can filter, flush out. I can let self be affected, but what they say or not accordingly. Security, free fall, diving in sea waters, it's not like a shield around, it's a temporary one, only around when I want it. I can see outside, they can't see inside. I can maneuver, I can see all around. It's not heavy, it's strong, like it will not break easily. And it's easy to stamp, crush it with feet, scramble it, tear it apart. I feel safe, rock, grounding. And I gave her the clamp, right? I gave her Venus Marcinaria. Let's see the words for the clamp. I can let in and out whatever I want. As I told you all, when we did the structure, there is a siphon like a structure which is mostly for the clam. They have this like a tubular structure, which they just keep it out of their body, and they say that is the in and out of the water flow to the body of the animal and the water. I can filter. I can let self. They are filter feeders mostly, these clams. Hence this kind of a language, and I chose clam for her. I can let self be affected by what they say or not accordingly. I can see outside. They can't see inside. Take in good energies, flush out negativity and bad energies. I can filter what I want to affect me or not. Easy to stamp, crush it with feet, scramble it, tear it apart. So I went to Dr. Massimo's Sea Creatures in the reference works, and here, as we both said Calcarea carp, the doctor earlier she said Calcarea carp, right? So often there may be clear symptoms of Calcarea carp, but the general picture doesn't fit. The most striking thing is that they develop very slow processes. They don't have many common acutes. They look very healthy for a long time, but when they started to be decompensated, it's like they start to get serious disease. Serious disease like this case, having autoimmune condition, right? So Venus morcinaria lives most of its life under the sand, not on the surface like Calcarea carp. Okay, so this was a little difference here. And then also I read something more from Vermeulen's synoptic reference. Here I read about the substance. Yeah, Venus marcina is a bivalve mollusk with a large heavy shell. It is also known by common name of bivalves. Yeah, we can read this from here. Then I took some rubrics in the case. We had some physical generals, right? We had the heat, we had the food, meat aversion, eggs desires. I took inflammation of joint, the arthritis, the head perspiration profuse, face perspiration profuse. I got the first remedy as calcarea, right? And then I got these three, that is Venus morcinaria. All of them are mollusk, right? Even calcarea is an animal. Then some more rubrics I took in the case, having like mind, dreams, murder, mind, dreams, frightful nightmares. Middle East themes I took company, stomach, nausea, eating amyloids, generalities, inflammation, joint arthritis. Here I got Venus morcinaria, sepia, calcarea, right? All of them, even murex, conchulinum, cypria, but most of them are covered by Venus morcinaria and the earlier things. The prescription here, I would have given her 1M potency because she was much on the delusional level, right? But I did not have it at that moment in time. I had to just get it from some colleague, and I prescribed 200. So initially I gave her 200 BD for 2 days and SL into 2 months. When she seen me in February, that time I just gave her Saclac because she was good, right? Even in March I gave her Saclac. But then after a long time, when she came in August and when she had the emotional turmoil, that is the time I gave her in the plussing method, TDS, and then I gave her that for 3 months. And then now also this case, even it's been 10 years, the patient still stays abroad there, and she's still in connection with me. And she does take her stock of medicines for a year, out of which I just give her Saclac. She doesn't have much of the flares. Only whenever she's little emotionally disturbed, she might get a kind of a small like a rash, I mean a lesion on her skin, but not those psoriatic, those the arthritis never came back. And that time she just takes one SOS. I just keep some SOS powders with her, but she's still in connection with me. She is a really obedient kind of a patient. So that was the case. Now let us see something about the clam. What are the remedies that we have from the clam? So we have Venus morcinaria, which I gave her. That was the hard shell clam. Then we have Venus morcinaria flesh. We have Venus morcinaria shell. Basically, the clam belongs to the class Bivalvia. The clam, it got its name from the way it shuts its shell. It has two equal oval-shaped shells, which are connected by a hinge, and they close by two adductor muscles on both the sides, and they open by a ligament on either side of the hinge, right? They have a well-developed foot, which is used to bury itself into the substrate. The mantle, as I told you, it forms into a siphon tube, which helps to filter the waste. That is the outflow of whatever that is not wanted, the negative thing, what she was saying. The filter the waste by the flow of water in and out. Yeah. So they have the two siphons, which one acts like an inhalant, which takes in the good, the oxygen from the water or the good things from the water. But and also they have an excellent siphon, exhalant siphon, which gives out the waste, right? It is a filter feeder. That means that whatever they have in the water, the plankton, algae, right? They just filter it and they eat that, they consume that, mostly eating plankton and algae. In danger, it retracts the siphons and closes its shells tightly, and it buries into the substrate and hides itself under the surface, or simply moves away slowly, because the movement in the bivalve, mostly the clamp is slow, right? The slowest of all or no movement at all is the oyster. So that was it for my presentation. Do we see the other three bivalves? Do you all want to see them? Yeah. So do we have the time? Yeah. Okay. So can I go ahead with the other bivalves?
Yeah, go ahead. No problem.
Yeah. It will be just a very short thing. I finished in 1 hour, but this is the oyster, the second form of it. So as we see this, this is mostly, it is stuck to the seabed. Yeah. And the shell is also very kind of rough, and it's not like the one which we see in the clamp. And this is the basic, this is how Dr. Mahesh Gandhi teaches us about the mollusk. So I will just speak about the way he has taught us. I will not go into much detail. So this becomes a little practical for us to see in the clinic. So he says the oyster, it is mostly, it goes down on the seabed. And that is the way it is usually naturally, and it is stuck there. So how it represents in our patient, they mostly want to settle down in life. They make money. They want to make money like Calcaria. They don't like any changes, because for them, making changes is like shaking them. Yeah. And their survival is being stuck, because as we see this mollusk here, the oyster, it remains stuck to the seabed. Yeah. And whenever the predator comes and it tries to get hold of them, as it is, they do not have their movement. They don't move much. So what they do is they have something kind of a sticky substance which just they cement themselves to the rocks or to the seabed. And how much ever the predator tries to move them, they don't have to move. That is their basic survival. So they have to be stuck. So that is their survival mechanism. This is the bivalve, which is always stuck to things in life. Yeah, so that is the oyster, and they also make pearls. Then we go to the next is the mussels. We see them here. These all, they look like clams to us, but they are larger shells. They have large, big shells, and they are mostly bluish, blackish in color, and they all are found stuck to each other. They are not separate. They be in these regions which are intertidal regions. That is, whenever there are high tide comes, so all of them, they come, they are at the shore, and they come with the high tide in there and stuck. They remain stuck to each other. And what they do by sticking to each other, they collect more of water in them, like they just trap water, because when the low tide happens and the water just goes back, they will just remain exposed. And if they are alone, if they are just separated, then they might die with these. They might dry up due to sun, and they might die. So mostly, how we see it in the patients, we see, okay, here all black shells, they were cluttered and they are stuck together on the rocks. They are basically Kali-like, the Kali remedies, always together, want to be together. If they are not together, they will not survive. I told you all why they are together. They live in the intertidal region. They need to survive by being together. If they are together, they can block some water in between them. But if they are alone and the water goes off in low tide, they will be left on the shore and they can die by drying up by the sunshine. Yeah, so the main the survival energy in the mussels is to be together. So this is how we can remember in our whenever we reach to a mollusk case and we are wanting to know which of them to give. this knowledge helps us. So hence I thought of sharing this with you. And the remedy from the muscles is Mytilus edulis. Then the last one we will see is the scallop. This one has the strongest shell, yeah, and it is also different. It's like corrugated, and uh, it is the fastest because it's well developed. And this is the only bivalve which has much faster movement. As I told you all before, that it just claps. It claps its shell, and it even makes a different type of sound. When you see it on YouTube, I didn't know actually. I wanted to bring that clip, but I didn't know how to get it here. Hence, I could not bring it. So it is the most developed of the bivalves. It claps the shells and moves. While clapping, it makes a sound and it moves. The shell is well developed, well corrugated. It is very strong, and they are the tough ones. Out of all the mollusks, basically these mollusks, as we know that they are the primitive creatures, they are very early in evolution. They are very fearful, fear of injections, because we know the fears of calcaria, as we all earlier thought this case to be even calcaria. So the fears of calcaria are the fears of mollusk as well, right? Fear of injections and all these. But here the scallop just becomes a tough one. It says that I do not fear this. I do not fear the injections. I don't fear anything. And they will try to not show their weakness easily. So that's all. I end with the rest three of them. And I say thank you to all of you for having joined me today and have been wonderful people. So any questions to me?
Doctor, what is plussing method? Plussing method.
Yeah,
You have
plussing method.